Growing Pains, Mental Health and Mississippi's Children.
His background may have been from neglect and abuse.
You can't rob a bank and run out in the yard and say, out in the streets, I'm having a mental health crisis, and we go, oh, okay, well, let's put the money back and we're now going to carry you for an assessment. That's not the way it works.
I have bipolar disorder type 1 with psychotic features, and in the year 2000 I survived a jump off of the Golden Gate Bridge in an attempt to end my life.
And now, Dr. Rick DeShazo and Melissa Faith Payne.
Anxiety, schizophrenia, depression, bipolar disorder, post-traumatic stress. More than 42 million Americans suffer from mental illness each year, and 1 in 5 children in the U.S. have poor mental health.
But did you know that 35,000 children in Mississippi have severe and persistent mental health needs? On this program, we'll discuss mental illness in children with highly trained professionals who have extensive experience in this field.
And we'll hear from parents of children with mental illness who live the struggle every day. But first, what is mental illness?
It's difficulty, an illness that comes from the brain that affects mental or emotional well-being. It can affect the way we think, the way we feel, the way we concentrate, and the way we interact with others.
Dr. Susan Buttress says mental illness is a complex world with emotional highs and lows, especially in children.
Unfortunately, one problem in children is that the recognition is often very delayed. Often children don't know what they're experiencing. Many times they are viewed as behavioral issues, behavioral disorders, children who are just bad. The face of a child who's depressed often is an angry child, behaviorally acting out child. So it's not recognized that this is a child who is sad. Many times an anxious child is a child who will refuse to go to school, or a child who will refuse to go out and play or interact with others.
According to the Centers for Disease Control, the most prevalent diagnosis among children is attention deficit or hyperactivity disorder, also known as ADD and ADHD, followed by behavior or conduct problems, anxiety, and depression.
I'm Sharon Townsend. I have an 11-year-old son named Damien, whose official diagnoses at this point are ADHD, severe oppositional defiant disorder, bipolar disorder, dysgraphia. We call it anger issues and ADHD. Technically or officially, his classification is emotionally disturbed.
Historically, most families have just dealt with the mentally ill at home. The state of Mississippi provided asylums for the seriously mentally ill away from the public starting in the late 19th century. In the mid-20th century, asylums were closed and government-funded community health centers were opened, but the state hospitals located in 4 areas of the state still serve those with serious mental illness.
Public community mental health centers, they do not turn away anybody regardless of whether they can pay or not.
Community-based treatment for children from therapists, psychologists, and psychiatrists is available in outpatient settings like an office. It's also available in inpatient settings like acute care facilities and long-term residential facilities for children. Navigating the system for the appropriate care in the appropriate setting has been called difficult.
If a child has more than a case of mild ADHD, quality mental health care can be difficult to get in this state. Emotional disorders, there really isn't a set support group in this area for that. Most of the help is geared toward people with physical disabilities, not emotional disorders. If you have a child who has true emotional disorders, you're basically on your own, especially when you have one like my son who's extremely intelligent. People tell me all the time, I don't see it. So then the parent ends up looking like the villain because I don't see that. I just can't believe that child is like that.
Dr. Rick DeShazo talks with mental health experts about children's mental health. Joining him are Dr. Timothy Summers, Dr. Susan Buttress, and Dr. David Elkin.
We're talking about mental illnesses in children and mental health in children. How do you classify the disorders of mental health in children?
There are large categories, and to start off with, you would think of developmental disorders to begin with, things such as perhaps autism spectrum disorder and developmental disorders in general. You'd also move to behavioral disorders, sort of oppositional defiant disorders and things like that. And you'd also have mood disorders that would include anxiety disorders and depression. You'd also have another large category of learning disorders. Children who have difficulty with, say, dyslexia, or difficulty reading, or learning math problems, or things like that. And then finally, though it's rare, you would have psychotic disorders. So those are some broad spectrums. There are other things out there, but in terms of what we're looking at, it's a very wide array of things that children face. In fact, they mimic, obviously, a lot of the things that adults face, but in a different way.
So, Dr. Summers, as a psychiatrist in practice, and I understand we have very few psychiatrists in Mississippi who see children and young adults, what part of this spectrum seems to be most common in your practice?
Well, the problems that I see most often are generally by the time a child or adolescent comes to see me, their problems are of such a nature that they're not able to function in school, they're not functioning well at home, and they're not functioning well in the community.
So it's almost a crisis by the time they get to the psychiatrist.
It may be a crisis, but it may be a chronic type of crisis. Mm-hmm. Chronic in the sense that they might have been in multiple treatment interventions before, outpatient, other inpatient settings, but generally inpatient settings that have been a short duration. A lot of different things have been tried, a lot of different interventions have been tried, but none of them have been successful.
Mental illness takes a toll on those with it and those who care for them. It can be complicated and costly, unfair, and frustrating. In a study by the CDC, approximately 8% of adolescents aged 12 through 17 years reported more than 14 mentally unhealthy days in the past month. Experts say not dealing with mental disorders a child has can lead to deeper problems in their teen years. Some teens develop mental disorders, drug and alcohol abuse, self-harm, and suicide are among them. According to the CDC, 4.7% of adolescents between 12 and 17 years of age reported an illicit drug use disorder in the past year, and the overall suicide rate for persons between 10 and 19 years old was 4.5 suicides per 100,000 persons in 2010.
My name is Kevin Hines. I have bipolar disorder type 1 with psychotic features, and in the year 2000 I survived a jump off of the Golden Gate Bridge in an attempt to end my life. It's the worst day of my life, and in some ways the best, because I lived, I was able to recuperate, find recovery with living with a severe mental illness.
Kevin was 19 and been battling mental illness for 2 years. He was seeing a psychiatrist after having a mental breakdown his junior year of high school.
Because I was in such great denial. I was seeing a psychiatrist, I was talking to therapists, I was going to these places, and I was pretending to be okay.
Kevin, now in his 30s, takes his story to mental health professionals around the country. He says part of the problem was not following his treatment plan.
Part of it was that on the weekends I'd binge drink until blackout while on psychiatric meds, something that could have killed me. Another piece of it was this great denial. I don't have this, I don't want to have this, and I played football. I was a champion wrestler. I was on the speech and debate team. It didn't make sense, so I hated it.
How do mental health illnesses start in children? Find out more with Dr. Rick.
Do you see a connection between developmental disorders, and we need to explain what those are, and mental illness in children?
Right. One thing that a friend of mine a few years ago coined was brain health and brain illness rather than mental illness because of the connotation. And child development is part of that brain health. And normal development or typical development is what we see in children, and then when it falls out of the line of normal, then we start looking at the reasons that it could be. It could be ADHD, it could be oppositional behavior, it could be something as simple, or maybe not so simple, as a sleep disorder, or it could be a significant mood disorder that's developing in a very young child. So one thing that Dr. Summers was mentioning is that by the time it gets to him, the problems are so severe. One thing that can happen is you can develop what we call comorbidity, another issue that develops because of what's been going on with the child. So you might have a child with a learning disability, and then what happens is the learning disability is not addressed, the child gets anxious about what's going on in school, and then maybe even depressed. Then they start acting out because they're failing in school. People are telling them they're not trying, and they're trying. So it becomes just a vicious cycle. And so many times, by the time the children go to a good psychiatrist, they are already in the ditch and having great trouble.
Where are these usually picked up? Are pediatricians good at picking up the kinds of disorders that need to be referred out, or do they try to take care of them themselves? What are the guidelines for that?
Well, there are guidelines to pick up developmental disabilities in that pediatricians are supposed to, at well-child checkups, screen children for developmental delays, developmental or behavioral issues. So typically they screen for not just when they're crawling and walking and sitting, but also when they're talking, how they're doing socially and emotionally, whether or not they seem connected to the parent, whether or not they're acting out, and things like that are part of the well-child checkup and part of the screening process. Mm-hmm. Most pediatricians are doing that now, though not all. Sometimes the children aren't picked up in having their developmental problems until they enter school, which is really late. And so what we really hope is that, one, parents understand that if they see something that concerns them, that they need to go and talk to their primary care provider, whether that's their pediatrician or family practitioner or nurse practitioner. They need to let them know they have a concern and then insist that this be addressed.
My name is Debbie Waller. I have a son diagnosed with a mental illness.
Debbie and Larry Waller adopted their son Michael shortly before he turned 5 years old, but when he got older, they knew something wasn't right.
He did have some behavioral issues early on. His background may have been from neglect and abuse, and as we got to know some of his biological family, we found out there were some mental health issues, but we didn't know exactly what they were.
She says Michael started showing signs of a problem in 5th grade and was diagnosed with attention deficit disorder.
He's one of those who just kind of zone out in the classroom, and he smart, bright individual, but just tuned out and didn't know what the teacher was asking or what the teacher was saying. He wouldn't remember to study for a test or any of those things. So we had to work with him a lot with the teachers, and with me being a teacher helping him.
Then he started showing other troubling signs in high school.
Socially, had been more awkward, didn't he, Larry?
Yeah.
More trouble fitting in. Not how would you say it, communicate with others. His social role, how to play that social role with others. I mean, he was always wanting to be the one that had lots of friends, but he never knew quite how to make that friend. He became more isolated. He stayed in his room more. He didn't interact as much with his brother. You know, and a lot of adolescent kids do that. They stay to themselves. You know, that you think it's just a phase they're going through.
Got agitated real easy.
Yeah, especially with us.
Yeah.
Things seem to bother him more.
And looking back, we can see it, but at the moment, we thought maybe it was just a typical teenager.
Debbie and Larry say the stigma that goes along with mental illness has been the biggest barrier during their journey taking care of their son.
I think one of the biggest things that bothers me the most, people think intellectual disabilities and mental illness is the same thing, and it's not. Mental illness, mental health, they are very intelligent individuals, and you don't, I even seen family members talk to him differently, like he's a child, not adult conversations. And just him living in the community. There's not many people that really reach out to him.
What challenges do teens with mental health problems face?
Teenagers frequently get disconnected from pediatricians and get to specialists like clinical psychologists like you are and psychiatrists through other routes. How do they get to you? How are these problems picked up in teenagers?
Oftentimes the teenagers will come to us from pediatricians, as you said, but most often from parents themselves. Because a teenager, when he or she's acting up, usually are acting up in ways that are pretty visible, and the parents oftentimes feel like they can't handle it on their own.
Is there a difference in the natural history as to whether you recover from one? Is it like having pneumonia? Can you make a diagnosis and treat one of these diseases and that's the end of it?
Some of them you can, and that's the optimist in all of us who deal with behavioral and developmental issues in kids. We really believe that many of these issues can be fixed if you can. Unfortunately, some can't. And I'll let my developmental pediatrician expert and the psychiatry expert speak to those. But a lot of the issues that you're talking about can be treated and can have very good outcomes with proper evidence-based treatment, medical and psychological. And so we really are seeing great advances. For the past probably 100 years, there have been no pathognomonic markers for psychiatry or psychology. You can't take a blood sample and tell if somebody has anxiety versus depression versus ADHD. We've gotten much better at diagnosing these things with measures and with reports, and much better at using good treatments to get kids the help they need in a timely manner.
Statistics show the state of mental health in Mississippi is not good. According to the National Center for Children in Poverty, 1 in 5 children in Mississippi, approximately 131,000, have a mental disorder or health problem. Half of all lifetime mental health disorders start by age 14.
You have your kids that are having minor symptoms of depression, anxiety, which of course may run through the family. Family genetics always plays a toll as well. Then you've got the kids that on the severe end of the continuum that are receiving services from multiple agencies, but that even before that had risk factors that put them in place to have mental health problems, issues anyway. And those types of things are low income, poverty levels, the family dynamics, single parent households, child abuse, domestic violence, neglect.
According to Mental Health America, when compared to other states and the District of Columbia, Mississippi is near the bottom of the list with the highest rates of mental illness and lowest access to care. According to the Kaiser Family Foundation, 32% of adults report poor mental health, with slightly more women than men and more blacks than whites reporting poor mental health. Experts say there are varying degrees of mental disorders and that early detection and treatment are extremely important.
We asked families of young children, what are you experiencing? And it was children at risk for mental health challenges. And they were saying that their children had some really significant problems and they wanted to get them help. But first of all, no one believed that children that young could have problems. And then they had a lot of fear that by saying that, my child's having these problems, I don't know what to do when he won't go to bed and he's staying up all night or he's, throwing things in stores all over, that their child was gonna get taken away from them because people would look at them and say, well, you're just a bad parent, and that's the problem. And in reality, what they were needing was help that would really address that child's needs. And it's not about labeling a child at that age. It's about identifying symptoms that we know if we treat them early, they're going to go down a better path than they otherwise would have.
Where can you access mental health care? Coming up on Southern Remedy.
Well, one of the things that quite honestly breaks my heart is seeing how many kids end up in emergency rooms having never had anything really done for them from a brain health standpoint, who end up getting picked up by the law for drug or substance abuse, fights, acting out, all kinds of behavioral disorders, and then they go right to the psychiatrist if they can get to see one. Is that frequent in your practice?
Well, it is. The majority of young people that I see are referred by criminal justice system. Depending on the ethnic cultural group, that has a big influence on whether or not someone goes to the emergency room for treatment, or whether or not they go to their primary care physician, or whether or not they seek psychiatric help. Young people, by the time they get to me, because of drugs and violence and not functioning in school, if a child has a learning disability, or they're not able to read or understand very well, then they go to school and they don't let anyone know that they're having these problems. So rather than allow themselves to be identified as someone who's slow, then they'll act out and act bad. So it's more acceptable to be bad than to be slow. So those children frequently kind of fall through the cracks. Their behavior becomes so intolerable that they get suspended from school, subsequently expelled from school, and then they're on the streets with other children with the same type problems. Then they continue to use more drugs, continue to create more crimes, and then it becomes a vicious cycle. And if we're not able to intervene early enough, then they end up in the criminal justice system.
Fortunate for us in our community, we have Alliance Health Center, who has been a partner from the very beginning with our program as well. They have services for adolescents, and they are our single point of entry for a juvenile. The same type of process occurs where they're assessed and a determination is made as to what to do to help them next.
Chief Deputy Ward Calhoun of the Lauderdale County Sheriff's Department says his department gets calls on a daily basis about people in a mental health crisis. The majority of them are adults, but when a parent of a teenager in crisis calls, a specially trained crisis intervention officer takes the child to a mental health facility for an evaluation.
Those juveniles would not be in an area with adults. They are separated. The idea is that CIT officer attempts to build as much rapport with that individual and help them to understand that they're not there to hurt them, that they're there to help them to get some help. And we then try to do what we commonly call a warm handoff, where we take that individual that now we have been trying to build some trust with. They've been riding in the car with us there, and we, not in a hurry, but very, very calmly introduce them to the staff, try to call them by name, talk with them, spend a few minutes there, have a little bit of paperwork to do, helping them to adjust to this new place they're at, because many times they're scared. Where am I? What exactly is going to happen to me? Talk to them a lot about, okay, she's a nurse, he's a nurse. They're going to ask you some questions. They're going to help you. It is an assessment, a series of questions where they learn about their medical history. They learn about if they had any kind of diagnosis, who treats them, that kind of thing. And then they make determinations about what, if any, meds need to be given to them in order to, depending on the situation, calm them down. Many of the people that we deal with are very anxious, they're frustrated, and so many times they're given what they determine is the appropriate medication to calm them down. And then typically those individuals within a couple of days are able to be released back out to go home for follow-up visits with their doctors, those kind of things.
But when the law is broken, regardless of age, there are still consequences.
You can't rob a bank and run out in the yard and say, out in the streets, I'm having a mental health crisis, and we go, oh, okay, well, let's put the money back, and we're now going to carry you for an assessment. That's not the way it works. If that juvenile is violated the law in some form or fashion, and they are ordered to go there by a youth court judge, that's just what's going to happen. Many times, you may not always know that there's a mental health aspect to what happened. in the juvenile facilities that we utilize for the youth in Lauderdale County, part of that introduction to that location, and as part of their coming into it, is there's an evaluation, and then there are mental health services available to that youth who's being housed in a juvenile facility.
Children at Risk with Dr. Rick DeShazo.
It seems to me that poverty and culture and race and access to care and food, all those social determinants of health, feed in not only to developing developmental disorders, but also in treating them and good mental health. Am I close on that?
You're absolutely on target. There was a study done called the ACE study, the Adverse Childhood Event Study, done by a big healthcare consortium in California, Kaiser Permanente, and they looked at adults and what happened to them when they were children. And this was a study done on middle-class working adults. And what they found was that children who had bad events during their childhood, whether it was a chronic illness, poverty, if they had a parent with a chronic illness or a death, or some sort of other violence in the home, child abuse, anything like that, the more of those negatives that these children had when they were children, the worse the outcome is for the adults. That's why it's so important not to get these children to adequate help by the time they get to Dr. Summers right now, but to get them to adequate help a lot sooner.
What is most important is the kids who end up with these poor brain health syndromes. Is it what is the origin or a mixture of all that?
So your question is a very good one. How much of it is genetics? How much of it is environmental? It's all. But I will say this: a lot of those things. Look, human beings are very resilient. We're built to handle tough times. We're made to handle things that don't go our way. Oftentimes, we're made to handle hurricanes that slam the coast. We're made to handle trauma. So you hear about the times when people don't handle it well. What you don't hear about are the times when people do handle it well. However, in that whole area, again, we're the optimists here. We want to help people overcome some of those things that seemingly are unovercomable. You know, those things that are so huge, like genetics and biology and neurochemistry. You can tamper with that through good therapy. And that's not just talk therapy, it's medical therapy as well, medicine and developmental care. So we really are seeing changes from the environment, but also because of the treatments we're providing these children.
All episodes in this series on mental illness in children are available on the PBS video app or on the MPB YouTube channel.
Go to mpbonline.org for web extras and more discussion about children's mental health.
For all of us here at Southern Remedy, thanks for watching.
Southern Remedy is underwritten by a grant from the University of Mississippi Medical Center.